Hello, my wonderful health warriors. Have you ever felt trapped in an endless loop with high blood pressure? Every morning, you wake up, take your pill, and ask yourself, is this the life I deserve? Or am I just managing a problem instead of truly solving it? The truth is, after years of dedicated research and work with thousands of older patients here in the US, I've observed a deep sense of frustration. It's the feeling of dependence on medication, even after trying to change your lifestyle. It's the weight of chronic illness holding you back. I want you to imagine this. What if I told you that a major part of that frustration, those pills you keep taking, stems from a cause we can completely cure? We've been so focused on treating symptoms that we forget that sometimes the enemy is hiding in a blind spot that only modern science can illuminate. Today, we are going to talk about a medical breakthrough, a refined, quick procedure taking only about 20 minutes that could bring you the freedom you've been longing for. Part 1. The Silent Enemy, Primary Aldosteronism. Detailed Mechanism. As a doctor, I love science, but I love the philosophy behind it even more. Finding the root cause. For decades, we have treated high blood pressure as a life sentence, something only manageable. But let's look deeper. Approximately 1 in 20 cases of high blood pressure, that's not a small number, is it? Does not come from too much stress or sodium, but from an endocrine condition called primary aldosteronism. I want you to visualize 2 tiny glands nestled modestly atop your kidneys. These are your adrenal glands. We call the hormone aldosterone the body's salt manager. It decides whether to retain or excrete salt and water. And, following biological philosophy, controlling salt is controlling pressure. But sometimes a tiny nodule, usually benign the size of a pea, a small rebel, forms there. Instead of listening to the brain, this nodule starts pumping out aldosterone uncontrollably. Your body gets the command to retain salt and water, increasing blood volume and constricting blood vessels. As a result, your blood pressure soars, refusing to obey any of the conventional medication. This is why PA patients often don't respond well to common blood pressure medications, and sadly, less than 1% of those affected are diagnosed. Millions are struggling with a high risk of heart attack and stroke simply because we have overlooked this silent enemy. I have witnessed many older patients, like my patient Clara, 75, who had to take up to 4 different blood pressure medications, yet still struggled with headaches and anxiety. For 10 years, she thought it was her destiny. But then, when we screened more thoroughly, we found that tiny rebel. The problem is, the old cure required removing the entire affected adrenal gland. That is major surgery, requiring general anesthesia, 2 to 3 days in the hospital, and weeks of recovery. Many, especially older adults, hesitated and chose to live with the hypertension. But now, the philosophy of medicine has changed. Part 2. The Beauty of Precision, Triple T, Detailed Procedure. This is where we talk about targeted thermal therapy, Triple T. The finesse of this method lies in its respect for the body. Instead of removing an entire organ, Triple T targets precisely that tiny rebel. It's a new philosophy of healing, minimizing intervention, maximizing results. First, doctors don't rely solely on sight. They use molecular dyes and advanced imaging scans to pinpoint the exact location and size of the nodule. Like a sophisticated target search, they determine precisely which cells are overactive. Then, the procedure is performed through the mouth. A tiny camera is guided down to the stomach, similar to a standard endoscopy. From the stomach, a fine needle is guided through the thin wall to access the nodule. There are no external or internal cuts, and then they simply use thermal energy, radio frequency or microwaves to generate heat, destroying that nodule in just 20 minutes. A simple act with extraordinary power. It stops the excess aldosterone production, leaving the rest of the adrenal gland healthy. and the results from the fabulous study are truly inspiring. The trial on 28 patients showed that 6 months after the procedure, most patients not only had normal hormone levels, but also completely eliminated or significantly reduced their need for blood pressure medication. This is more than just a number. It is the freedom returned to daily life. Freedom from the worry of taking pills every morning. Freedom from the burden of illness. Can you imagine that feeling? Triple T is transforming a chronic condition, lifelong medication, into a curable condition through a minimally invasive procedure. Patients can return to their normal routine the very next day. This is a game changer for older adults. Part 3. Warning and Wise Living Guidance. Detailed Habits. Now let's turn to a deeper aspect. Life after being cured. The success of a procedure does not mean you can forget everything. Freedom comes with responsibility, especially at our age. I want to issue a serious warning from my experience. Do not stop medication abruptly. The Triple T procedure takes time to exert its full effect. You must never arbitrarily stop any blood pressure medication you are currently taking. The decision to change dosage or discontinue medication must be made under the strict supervision of your specialist doctor. Regarding recurrence risk, the likelihood of primary aldosteronism recurrence after successful ablation is considered very low, provided the nodule was thoroughly treated. However, following the philosophy of medicine, we must prevent. You need to commit to monitoring your aldosterone and renin levels periodically according to your doctor's schedule. This is the only way to ensure no residual nodule remains, or that a new rebel does not emerge in the remaining adrenal gland. The freedom that Triple T offers is a gift. Use it to build an even stronger foundation for your health. 1. The habit of listening to the body, mindfulness. Regular blood pressure checks. Even if you have stopped medication, the habit of measuring your blood pressure daily at the same time remains the golden rule. It is no longer about disease control, but about listening to your body. Stress management. As a life skill, PA-caused hypertension may be cured, but stress remains a destroyer of our overall health. Find a stress reduction method that works for you, whether it's meditation, gardening, or gentle walking. 2. The habit of nurturing the heart. From within. Wise dietary choices. Although your body's salt processing mechanism has improved, consuming excessive sodium still harms blood vessels. Continue to maintain a low-sodium diet and increase foods rich in potassium, green vegetables, bananas, and magnesium to support your blood vessels. View healthy eating not as a sacrifice, but as an investment in the years of freedom ahead. Movement is not a duty. I am not asking you to run a marathon, but find a form of exercise that you love, walking with your grandchildren, gentle swimming, or joining a dance class. The goal is 150 minutes of moderate exercise per week. This is how you say thank you to your heart and blood vessels. My friends, life at this age should not be a daily battle with illness, but a journey to be fully enjoyed. Modern medicine, with breakthroughs like Triple T, is keeping its promise to free us from unnecessary burdens. While Triple T is still undergoing expanded trials, major results expected in 2027, it has opened a wide door of hope. I want you to carry this thought with you. The power to heal lies not only in the needle or the pill, but also in your determination. The determination to find the root cause, to pursue freedom, and to live as wisely as possible. If this story gives you pause, if you feel it might relate to your own condition, don't hesitate to ask your doctor about primary aldosteronism. That is the first step toward finding truth and freedom. Please share your thoughts in the comments below. Thank you for listening. Live healthily and enjoy every moment. I am Dr. Evelyn, and I will see you in the next video.